My name is Sarah Cates. I am an emergency medicine physician by training, and I was called to missions pretty dramatically, actually, in college. Maybe only a few months after I became saved, I was at an FCA meeting, and there was a man there talking about his friend who had jumped into a lake and actually became paralyzed. This guy wasn't even a doctor. It was just a bunch of us at FCA, and for whatever reason, the Lord used that moment to say, I need you to switch your major to medicine, and I want you on the mission field. And that was kind of it. And I switched my major. I was a junior, going to be a junior at the time, and went down a more of a science pathway and then on to medical school. I didn't really know what missions meant as far as like what capacity I was going to be doing missions, but I did feel like it was supposed to be part of my life as a doctor from the very beginning. Actually, I got connected through an article that Greg wrote on his blog talking about missions and being a good fit for mission fields as medical missionaries, and that prompted like an email to him to kind of talk with that more, and just kind of developed from there. I do think CHSC is a great organization for medical providers for multiple reasons. Number one, that's all they take care of is medical providers long term, so they're unique in that way, and I think they're extremely qualified and cognizant of the difficulties and the special things that medical providers actually go through on the mission field. And it's a huge passion of them to make sure that their missionaries are a good fit for the field that they serve on, and that they have outlets and advocates on that field as well. So yeah, that's kind of how I ended up here. I'll share the most recently, right before, maybe just in the last month, we had a little boy that came in on day of life 0. He was born outside and had what we would call an anoxic hit to his brain, so he didn't really want to breathe when he came in, and he was having a little trouble, so he needed to be on oxygen. But then through the workup, we realized that he had meningitis, neonatal meningitis, so we put him on antibiotics for that. And he just really wasn't getting better, so we redid his LP on like day 7 to check it, and it was much, much worse instead of better. So we realized that he wasn't getting the right antibiotics, so we changed him to something extremely strong and put him on like 14, 21 days of that. And during that time, he really just didn't do well. He fully arrested once. Requiring CPR. He dropped a lung, complete whiteout of a lung requiring an emergent chest tube. He just was clinging to life, really, and it's those times where you're kind of like, oh, I don't know, I just don't know if he's going to make it. And he was on so much medication because he had such a bad infection in his brain to keep him kind of sedated, that we're like, oh, I don't know if we take this medicine off if he's going to come back out of it. And but slowly, he was able to get the chest tube out. He was able to come off the oxygen. We started weaning the phenobarb that was keeping him sedated. And, like one day he just kind of opened his eyes and started crying. And we finally moved him out of our ICU to the regular ward. And the next morning his mom was like, but he cried all night. And I'm like, oh, yeah, babies do that. But he'd been so sick for his whole life that he'd never cried all night, so she didn't really know what to do, and this is her first child, and I was like, oh no, that's normal, and yay, he's crying, like that's a great thing. And anyway, so yeah, he got to leave the hospital. He still needs some help eating, so we did have to put a G-tube in him to feed him at home, but I really do think he was doing well enough that we'll probably end up being able to reverse that in the next 2 or 3 months. So I'm excited to see how that unfolds. I think we do get a lot of short-term people on our field, which is great. They're a great relief for us. They're a great break for us. We also have quite a few medical long-term people as well. My biggest advice for anyone that's medical, regardless of the profession, that wants to do this, is do it. There's a way to do it that will fit your schedule, that'll fit your family needs, that'll fit your lifestyle and your hopes and dreams, for lack of a better term. It's not a one-size-fits-all occupation. So it doesn't have to be you're there for 20 years and you never come home and all these things. It can be I give them a month a year, I give them 6 weeks a year. That's amazing. We would love to have people, and we do have people that come back every year and serve with us, and they're amazing assets to our field because we know them, we trust them, they jump in, they really are a break for us because we can turn over our patients and know they're being taken care of by somebody that's been here in line with our vision and what we do, and the quality that we want in the hospital. And I also would just recommend whatever field you think you want to go into it, and the Lord will use it. Don't listen to people that say you have to do a certain field, you have to do internal medicine, or you have to do pediatrics, or you have to do ER. It's just not true. Do what you want to do, and the Lord will use it. If you want to be a plastic surgeon, He'll use that. If you want to do neurosurgery, I'm sure there's somewhere He'll going to use that as well. So don't limit what God can do, and don't limit yourself. Regardless of what you want to do, go after that. You have to do that for the rest of your life, and then the Lord can use that and will use that however you want, allow Him to.